Welcome. Now we're going to talk about respiratory acidosis. So we've talked about the normals and what we expect to see. What happens if those normals don't happen? Or if they're off? In respiratory acidosis, we're going to see that the pH is less than 7.35 and that the PCO2, the partial pressure of carbon dioxide, is going to be greater than 45. Now, what can cause this? Well, you can have either acute or chronic respiratory acidosis. Acute respiratory acidosis has to do with hypoventilation. The patient is hanging on to that CO2 for some reason, so they're not getting it out of their lungs. They're not blowing it off. Now, this can be caused by by a central nervous system depression, which could be due to drugs, due to a cerebral vascular accident, a stroke, a head trauma. It could be due to neuromuscular diseases such as myasthenia gravis, Guillain-Barré, muscular dystrophy, polio can cause it, hypokalemia can cause it. You could have impaired lung movement, so a diaphragm that's not moving well, maybe due to a chest crush injury, maybe due to a pneumothorax or a pleural effusion. Or you could have very severe pneumonia that can cause a respiratory acidosis. Chronic causes of respiratory acidosis. Think about chronic lung diseases, obstructive diseases such as COPD, or restrictive diseases such as asthma. Chronic respiratory depression, central hypoventilation, or chronic neuromuscular diseases can cause a very chronic respiratory acidosis. So some signs and symptoms that you might see of respiratory acidosis would include anything that would lead you to believe that the client has a high CO2 or a low pH, and possibly even accompanying hypoxia. So they might have a headache, confusion, drowsiness, restlessness. There's that word. When you see restlessness, think to yourself, is my patient getting enough blood to their brain? You might see stupor, which is also called carbon dioxide narcosis. You could have some memory changes, some personality changes, and it can be acute, so very acute mental status changes. Chronic respiratory acidosis could be well tolerated because it goes down slowly. But there could be some mental status changes, and a chronic respiratory acidosis can become a problem if the client gets sick, like with pneumonia, and it suddenly gets worse. So watch for any acute changes in a client that may indicate acute exacerbation, restlessness, hypoxia. Now, typically the body's going to try to compensate for this issue. So we'll see that bicarb is high as the kidneys work to maintain homeostasis. This would be compensated respiratory acidosis. So let's put this to a couple of examples. If the CO2 is above 45, the bicarb is above 28, but the pH is still less than 7.35, well, it's not fully compensated because it hasn't brought the body back to homeostasis. That pH is not normal yet. So it's called partially compensated respiratory acidosis. If the CO2 is above 45, so respiratory, the bicarb is above 28, so the kidneys are working to reverse that, and the pH is normal, it's between 7.35 and 7.45, then you have fully compensated respiratory acidosis. So our CO2 is too high, but the kidneys are working to compensate for that, and they've brought the pH of the blood back into normal limits. Let's put this into a question, an NCLEX style question, and check your understanding. Our client has an ABG of 7.3, a pH of 7.3, a partial pressure of carbon dioxide of 63, and a bicarb of 27. Which of the following diagnoses do you expect to find in the client's chart? Number 1, DKA. Number 2, a motor vehicle accident with loss of consciousness. Number 3, hyperventilation. And number 4, chronic alcoholism. Now remember, we've got here a PCO2 that's high, carbon dioxide is high, and our pH is low, so we have a respiratory acidosis. So we can eliminate our two metabolic causes, which would be the DKA and the chronic alcoholism, because we have a respiratory problem. Now, number 3, hyperventilation causes alkalosis. So that's not the correct answer. We can eliminate it. But a motor vehicle accident with loss of consciousness, that can cause hypoventilation. It's a trauma. So that would be our correct answer.